the next question is for Dr. Shields, and I think it piggybacks off some of our discussion. And the question is, after our discussion of tarlatamab and the potential side effects, the necessity of hospitalization for the initial infusions, the question is it safe enough for patients to get it from their regular doctor, or do they need to go to a specialty center to get it?
That's a wonderful question. I think that, as this drug has rolled out since its approval in May of this year, there has been, a lot of hesitation from oncologists because they may not have the experience and they will express some hesitancy because, it is a new class of drugs and we really should have all of our ducks in a row to support patients before we get started. And so hospital systems, oncologists, clinics really are pumping the brakes to make sure that we have everything in place so we can safely offer this. And so, I would say that, finding a larger or an academic center that has experience with these type of bite therapies, these, molecular glues, these super glues we mentioned, I think is a great first step. And then, either going to that location or seeing if they can help with your local oncologist or center to help either consult, inform, or collaborate with them to provide care. Here at Indiana University, we are providing tarlatamab at our hospital, our university hospital in Indianapolis, and all of our satellites really are referring into us for the first few cycles so we can make sure that everything is safely administered in a very controlled fashion. Everybody is trained, there's in-service, and so we want to make sure that we provide this care safely in a uniform fashion to all patients. And so your system, your hospital system, your cancer clinic may look a little bit different. Good questions to ask your doctor, get a second opinion. That's always a great next step, and see if there's an expert locally that can help, that has experience with these drugs to help inform your care to provide it safely.
I agree, and I think these are not questions unique to tarlatamab. I think when we encountered amivantamab in clinic as well, with that infusion reaction that many patients have when it's given intravenously, I had a lot of my colleagues in the community setting where there was some difficulty or a lack of resources recognizing that toxicity, and so our patients were sent to the emergency room in other areas. And so as a group, we did see some of those patients at the kind of the central academic site initially until they gained the sufficient expertise. And so I hope that it's going to be a similar model where perhaps you start in a central model and then you can disseminate it out, because ideally you get care closer to home.